Hello. So, we're talking about addiction and overdose. It's the first issue that we're talking about in the Health Summit. By the way, we recognize that we are the first ever panel of the first ever Bloomberg Health Summit. So not that we're nervous at all, at all. All right, so we're gonna talk about police chiefs and people on the ground who have actually decided to do policing differently in terms of overdose and addiction. And it's policing with a public health head. So Brandon, Chief Del Pozo, because I just found out you're half Jewish, half Cuban. Chief Del Pozo from Burlington, Vermont. You have like a kind of extraordinary life story that we don't have time to do because we've only got 22 minutes left. But give us the very short version of your life history and kind of how it ends up in Burlington and you deciding to say, we've got a problem in Burlington and I'm not gonna do it the way the NYPD was doing it and making mistakes maybe 30 or 40 years ago.
Yeah, sure. I was a philosophy major at a liberal arts college, so I desperately needed a job. And in the late 90s, New York City had a big problem with violence. It was a city that I grew up in where I personally paid a toll for that violence and other people did. And I thought joining the New York City Police Department would be a great way to give back to my city and to make it a safer place. And there were some bumps along the road and a lot of public health professionals. We can talk about confounding variables all day, but crime did go down in New York. When I went to Burlington to change the pace of things and take up a new challenge, the mayor said on day one, Mayor Murrow Weinberger, opioids are what's hurting our populace. And the role of an American police officer is to protect and rescue people in danger. And if we're not using the police as vectors to get people the help they need, then we're not doing their job with the opioid crisis. So I was lucky enough to have a mayor that allowed us to be informed by science and evidence. I had a needle exchange that was a foregone conclusion. People are fighting the needle exchange.
That's where Grace works, yeah. By the way. We're going to get to
the syringe exchange. And so what we did, we took a policing CompStat approach to opioids, but not just with the police department. We took it with all sorts of public health professionals, the hospital, the Department of Corrections, the syringe exchange, the treatment people, driven by data, measuring the right things, not things for their own sake. And we ended up, as of late, with 4 or 5 really innovative pilots that are based in science to get medication-assisted therapy to the right people at the right time. And I'm proud that the police are actually vectors for that.
Okay. Chief Ryan, differently than Chief Del Pozo, you actually grew up in the projects in Arlington, Massachusetts. And now you're the police chief of Arlington, Massachusetts. So there's, I point that out because there's a real element of kind of humanity, sense of community that you kind of bring with you as a chief. I mean,
right.
I get that sense. But if you wouldn't mind telling us about that aha moment that you shared with me last night that I think really helps and will help put a context with how you decided to manage your approach to this issue.
Right. I often joke that half of my buddies went to jail, the other half became cops. And thankfully, I fell on the side of the fence of getting into law enforcement. So we're a densely populated suburb of Boston. And, you know, the aha moment for us was, you know, as the epidemic hit and the bodies were turning up and we were scratching our heads and looking at CompStat models and other approaches to addressing the opiate epidemic, I'll tell a quick story. We had a situation where a young lady who by all standards of measure would have been a success in our society. Beautiful physically, came from a family, stable family, father, a firefighter, a mom, an educator. And we've been arresting this young lady for minor drug possession. And she had experienced an overdose. Our officers responded, reversed the overdose with a nasal naloxone, and we brought her to a Boston area hospital. 7 days later, the same young lady overdosed. We responded, reversed the overdose with nasal naloxone, transported her to the same Boston area hospital. 7 hours later, we responded, and this young lady in her mid-20s was dead. And that experience for us made us realize that the traditional approach to public health and policing was failing. We reconstructed the situation, and we realized from the police to the emergency room, the entire system had failed. And until we, take a major transformation to the way we deal with this public health epidemic, we'll fail to turn that corner. I mean, the emergency room neither had the desire nor the capacity to treat this patient. They just wanted to release her AMA.
Which Fred, actually, excuse me, which Chief, makes me
Fred.
think about the way in which, because the aha moment is tied to another social issue that was looked at with the same kind of stigma not too long ago. It was domestic violence.
Yeah, and that's where when we started planning our programming, we looked at the lessons we learned from domestic violence. And what we learned was we used to, blame victims. Why are you living with this violent man? Why are you living with this batterer? And we put all the weight of this violence onto the victim in the abusive relationship. And we learned many years ago in law enforcement that was failed policy, and that we needed to empower victims, implement a survival plan, and build relationships so that when they became ready to leave those abusive relationships, we had established a partnership and we can help navigate away from these abusive.
And a lot of that is based on trust, right? There's a big
Hands
deal
down.
that's based on trust. So that's where you come in, Grace, because I'm imagining, you must be ecstatic about the fact that you get to work with Chief Del Pozo. You're not having to fight the battle of convincing your police chief that a needle exchange is going to help save lives because he gets it. So take us to the ground in terms of kind of what's it like to have the collaboration with the partners in blue when you know they're not going to be arresting the people who you're trying to help save their lives?
Well, I've been working in syringe exchange in Burlington for 11 years now, and so I've been there prior and in this current working with Brandon, or Chief.
Brandon, it's fine.
And for the majority of my career, we had a 2-year waiting list for medication-assisted treatment in Vermont. So people would come to me and ask me for help. I'd put them on a waiting list and watch what happens over the next 2 years as we, as social workers who never signed up for this job to say no to people, we're in the front lines of saying no to people who are desperately trying to get help. And watching them die, go to jail, and lose custody of their children, all while asking the public for help. So recently, fentanyl hit Vermont as it's hitting many of your communities, and we lost more people in the last 18 months than in the 18 years our organization has been in operation combined.
Whoa.
And I think with the common sense of urgency, the police, the emergency room, us, we all came together. The only positive side effect of fentanyl is that everybody's at the table now. And we came up with solutions, and surprisingly, in harm reduction, I'm not the one who had to compromise in any way, which is rare. Brandon and and he can talk more about this, our state's attorney had agreed to not prosecute for these medications that are saving people's lives, mainly buprenorphine, that's not prescribed. And then we decided to open treatment at our syringe exchange. So instead of missing that captive moment that I'd had to miss for the last 8 years or so, now when people ask me for treatment, we have a doctor available and we can write them a prescription the same day.
Which is a big difference than having to wait 2 years, right? Big difference.
Huge.
So this is one of the ways in which you're actually, by working together and actually sharing ideas instead of fighting each other, you get to some place that leads to some place where all of you then can take this local effort into national work. So one of the things that both of these amazing police chiefs did was that you developed 10 standards of care. And we happen to have some of them. You actually were saying, you guys were saying, you can't do all 10 because it's just. So Brandon, can you just tell us like the most important 10 standards of care that you and Fred were able to kind of come up with?
Yeah, so what really surprised me as I did the research and pulled back the curtain was how uncomplicated a lot of this was. That the cachet of mystery around public health was suddenly revealed. And the idea of a population-level intervention is very powerful, but also with opioids, we're dealing with medicine. And I had to ask my people, I'm looking at Josh, 6 or 7 times, is there really this very, very powerful medicine? Is there a trick here? And when the answer was no, I said, why the heck aren't we doing this? And so what I wanted to do was empower police departments to either start, do, or advocate for 10 things that are based on science that intersect with policing that would reduce opioid-related mortality. So the most important ones just all center around making police and the institutions we touch vectors for access to medication-assisted treatment. If you are going to arrest somebody and put that person into a prison, you have to ask that jail warden, why isn't this prisoner getting medication-assisted therapy, right? You have to understand that needle exchanges are a vector for treatment and a vector to stop the spread of disease. Don't fight them. Every cop should have access to or be carrying naloxone and apply it in a way that doesn't increase the stigma. I mean, this is all online. There's a beautiful website that the American Health Initiative put up. But the executive summary of it is just that we all know the science. It's been around for many years now, decades in many cases. And it's just turning those science into good policies that police have access to in their daily work.
So, Chief Fred, what's the one of the 10 points that is the one that you're proudest of, or the 2 that you just feel like, look, be sure to understand this?
Well, not standing in the way of safe use sites. I mean, we need to let science drive policy. In America, you know, I like to joke, if we let science drive policy, we'd close every fast food restaurant in America. But so that's a lofty goal.
And there are some people who would be kind of happy about that.
You know, so law enforcement needs to be agnostic when it comes to science-based programs that help navigate people into the treatment system rather than jail and incarceration. And the irony here is that, you know, thanks to Brandon's leadership and working with Josh and his team, you know, there was no political driver to get this done, or no legislative motivation. This was driven by the value systems of law enforcement leaders like Brandon across America. You know, we could be sitting in our offices playing solitaire today, and there'd be no political pressure to be doing what we're doing. And I think that really is the story of the day for leaders like Brandon.
Which brings me to this issue. One of the things that we talked about, I think Arnie Duncan just mentioned it, which is there's so much hopelessness in our country. We kind of can't not address it. And that's really complicated, as you all know. As a Mexican immigrant woman journalist, I know kind of how complicated these things are today. So dealing with hopelessness is important. What you 3 bring that I think is quite beautiful and important in all of our work is you bring a perspective of humanity. We are seeing people who are dealing with drug addiction not as criminals, but as human beings who are dealing with a health issue. So, Grace, can you tell us why it matters to have police chiefs who are able to see the people who you're dealing with through this lens of humanity?
Yeah, so I think one of the things that brought us all to the table, as I was saying earlier, is the overdose epidemic. And we are Vermont's largest pilot site for Narcan. We've handed out 20,000 doses. What happens then is sometimes we have people brought to our office overdosed. And more recently, we had somebody who was brought to our office who was overdosed, and I had to do rescue breathing. And they had a dog in the car, and the dog thought I was hurting the person. So the dog was coming close to biting my face. And it was fentanyl. He was not breathing. He was blue for an extended period of time. I had to give multiple doses of Narcan. And obviously the police and the EMTs show up. And when he came up, the first thing he did was ask me for help. This was back when we had a waiting list. And standing next to me were the police officers. And immediately, one of them asked me if I was okay, and one of them asked him if he was okay. And there wasn't any fear, and there wasn't any stress. And I've been on these scenes for 11 years. I've seen the other way around. I've had people get in my face and tell me that if I wasn't giving syringes, we wouldn't be there. I've had other situations. But to have it see that I think Narcan in itself reframed a lot of the way we see people who are using drugs. I think when you give out 20,000 doses in Burlington and Vermont, it shows you that people want to be alive and they want to survive this epidemic and they want to help their friends and their family members. And so I think having people see that over and over and over again, having our clients see that and having us see that when we get to an overdose scene and everybody there is looking to help and support the person, and then our police are really putting their money where their mouth is, advocating for Narcan, advocating for low barrier access to medications, and advocating policies that don't prosecute people for things that they're just using to survive.
So Fred, I know that both of you want to jump in. Go ahead.
No, I have a narcotics sergeant who's a very gifted investigator and very tenacious, Dan. And, he did a search warrant on a big case where he wanted to put some people shipping the opioids into the state. We don't grow poppies or synthesize fentanyl in Vermont. It all comes in from somewhere else. But at the scene of the search warrant, there were people who were addicted users, like very low-level folks. And one of them went into a panic and said, I'm going to get dope sick now. I'm going to start going into withdrawal. This is horrible. And he said, no, I'm going to take you to the needle exchange and get you a buprenorphine prescription now. And the narcotics sergeant took him there, and the guy started crying because he never had that type of interaction. And that was a moment that really, he was doing what I was ordering him to do. He knew my expectations. But when that happened, he really saw the compassion. And,
wow.
Fred said some nice things about me, but I feel sometimes like, am I alone here? I'm up in northern Vermont. Look, I'm in Canada. But it's great to know that...
We're not in Canada. Let's be clear.
But no, it's great to know that there are other men and women, chiefs like Fred out there who make you feel a little less out on the edge.
So Fred, jump in, and then I have a final topic.
Yeah, on the hope piece, the Boston Globe ran a series on what's known as Methadone Mile down near Boston University Medical Center. And the big picture in the Globe was two young men in an alley using heroin. And this was intended to be sort of the bad optics of the methadone mile. But as I looked more closely at that photograph, what I saw was hope. What I saw, it was clearly their works were clean and sterile and had been given to them by an exchange program. I saw a sterile wipe. I saw a clean Band-Aid. And I saw that they weren't using alone. And to me,
wow.
that the optics of that photograph, although intended to be negative, demonstrated to me that our harm reduction efforts are working in the city and beyond, and we need to keep the pressure on. I saw hope in that photograph. Which
is what I want to... You didn't even read my mind, Chief Ryan, but that...
We have superior training, so I know.
Did I mention that he was not only at the FBI at Quantico, but also at Harvard? So, I want to talk just really briefly about the possibility of hope, right? The possibility of hope and of dreaming of things that can change. And then we're going to transition into something that makes sometimes hope difficult, which is the stigma. But just before we cue our video from Patrick Kennedy, can you just say a few words about hope in this moment?
Yeah. In the last month is the first month I've been able to offer buprenorphine access. And literally we're asking people if they want it in the moment. And we're also allowing people, because there's no scarcity mentality, we're allowing people the chance to give it a try and see if this is something that they want. There's no pressure. There's no pressure to stay in. There's no pressure to jump through hoops. It's very low barrier, getting people the medication they need when they need it with somebody who's very compassionate. We got an amazing harm reduction doctor. And the look on their face when you tell you, we can give you this today. And my staff who's offering it to them waited 2 years on the waiting list, has been in recovery, and is now working for us. And so for her to be able to be the person to offer somebody something like that in the moment and watch their faces and actually within minutes get them, we're getting people who have never had treatment applied to them, people who have such mental health issues that they haven't been in a moving vehicle for 20 years. So this is hopeful. We're treating people in where they need to be with compassion.
And exactly. Hope is in many ways the other side, the positive, uplifting side of stigma. And the stigma that we all carry. I was thinking, maybe all of us should start talking about drug abuse and addiction and overdose in our own families, what we know, because if we can't reveal it here, then we too are victims of stigma. So maybe that's something we can all practice while we're here. We have a very special guest who couldn't be with us in person today, but he has recorded a special message. Can we cue the video from Congressman Patrick Kennedy, who is the founder of the Kennedy Forum, talking about stigma?
I grew up in an alcoholic family and became an alcoholic myself because it ran in my genetic makeup. In my own instance, my family was the connectedness that brought me back from addiction. And I'm so blessed to have 5 children and a beautiful spouse who understands my addiction and who supports my recovery. My own experience suffering from these illnesses has made me want to advocate for others who often are suffering from an illness that is treated as a moral failing as opposed to a medical one. That has to change. People often have asked, what has made this opioid crisis so difficult to address? As someone in recovery, I think it's because we haven't addressed it as the public health crisis that it is. If our country treated addiction as a health problem, we wouldn't be arresting people first and asking questions later. We'd see them as human beings in need of help. I'm so encouraged that all of you are here for the first ever Bloomberg American Health Summit and are working so hard to use data, fight stigma, and above all, bring a public health perspective to the opioid crisis. If our country treated addiction as a health problem, we'd be offering treatment to people. Treatment that could save lives.
You all broke through the stigma. Each of you in the work that you did broke through the stigma. Can you just leave us with one thing each of us can do to break through in terms of our own stigma and how that will help us in terms of forming our allies in blue? Chief Ryan.
You know, I responded to a scene of a fatal overdose. It was the brother of one of our police officers. I don't typically go out to the fatalities. And literally on the other side of the wall, a young man lay dead, and I offered my condolences to his mom. And she sat in the armchair in the living room, and she looked up at me, and she said, "Thank you for the work you're doing around addiction in the community. We were just so ashamed to admit that he was an opiate user." And so to be able to help people navigate their way to the support systems that are in place in progressive cities like ours is incredibly important. And also to set aside the stigma associated with medication treatment therapies. There's a whole issue with that as well.
Okay, 15 seconds. Grace.
Get to know people who are struggling with this disease. I bear witness every day to how hard this disease is, but to the amazing resiliency and the stories and the people that I get to be around. That's the privilege of my career, is to get to know these people and see the real strength and the real positivity that they bring to my office every day and to this world every day.
Brandon.
I think I started by saying what I'll say again. We're the government, and our first job is to protect and rescue people in danger. And if we take that seriously, we're going to have to do it in a way that shows compassion and breaks down stigma. And if we don't do it in that way, then we're just not doing our job.
Thank you to all of you. Thank you to this summit. Thank you to this conversation. The next topic actually is another one that really shows that this conference is dealing with these issues differently. Thank you to my panelists.
Thank you.
A video now on the issue of environment. Thank you so much.